Now, the food that we eat travels almost 30 feet through our body before it leaves it. Now, the last 5 to 6 feet of this is the colon and the rectum, and this is the part where colorectal cancer starts. So, it's a cancer that starts in the large intestine or the rectum, which are the last parts of our digestive system. And normally, the lining of this intestine it keeps on renewing itself, but sometimes, due to irritation, which is long-standing, or due to genetic reasons, abnormal cells grow out of control and they form a tumor. So think of the colon as a plumbing pipe. Now, if it gets blocked at any point or a growth develops inside, now the whole system will suffer. So that's a colon cancer or colorectal cancer. So now, if you have a family member with colon cancer, technically your risk almost doubles. But lifestyles are a bigger risk factors. So people who have a bad diet or addiction. So bad diet includes a diet which is low in fiber, high in red meat, lots of processed foods. Lifestyle factors such as obesity and no exercise, addictions such as smoking and alcohol, they are at a higher risk. Again, age plays a role. People more than 50 years of age, the risk is higher in them. People who have chronic bowel problems such as ulcerative colitis or Crohn's disease, also known as irritable inflammatory bowel disease, they are at a higher risk of getting colon cancer. Now, the biggest problem with colorectal cancer is that early cancer almost has no symptom at all. Now, the commonest symptoms can be something like a change in bowel habits, that is the earliest symptoms. It can be constipation or diarrhea, which is lasting for a long period of time and is unexplained. Then, change in the color of the stools. The stools can be red, it can be reddish black, it can be frank black, unexplained weight loss, persistent abdominal pain or bloating. Sometimes there is weakness which is unexplained. Sometimes the hemoglobin is constantly low, for which no reason is found. All of these can be symptoms of colorectal cancer. Now, a person who has all these symptoms of colorectal cancer, or somebody who has long-standing piles or fissures which are being treated as same but are not improving, they can also have colorectal cancer. So they are subjected to all these tests for colon cancer. So colonoscopy is considered as the gold standard. So it's a simple camera test which scans the whole of the colon, and if you see a suspicious lesion or a suspicious growth, they can be biopsied at the same time. Very early disease, you can even remove the polyp or growth in the same sitting. Other tests include a stool test for blood, or there can be imaging. When there's a diagnosed cancer or you have a high suspicion of cancer, you can do a CT scan or an MRI, which will show the tumor. So again, I would like to emphasize on the fact that colonoscopy is just not diagnostic. It can be preventive. It can be therapeutic for treatment also. So unfortunately, unlike some other cancer like cervix cancer where you have the HPV vaccine, in colon cancer there's no vaccine as of now. Research is going on, but at present it's mainly prevention based on lifestyle changes and screening. So the best vaccine as of now is a healthy lifestyle and timely screening. So the good news here for colorectal cancer is it's one of the most easily treatable and curable cancers if it is caught early, and you get good long-lasting results also even in a moderately advanced cancer. So very early disease, like I said, or pre-malignant lesions like polyps, which later form cancer, you can treat them during endoscopy as well, or colonoscopy, as we call it. The once it becomes more advanced than that, whether it is early or locally advanced, surgery is the main form of treatment, like a proper removal of tumor with oncological principles. That is the main part of the treatment. Once it becomes locally advanced, or it becomes goes into the middle stages. Along with surgery, we may need a combination of chemotherapy, sometimes even radiation. Very advanced disease, sometimes chemotherapy is given before that. Once it becomes metastatic or stage 4, we often need things like targeted therapy and immunotherapy, which are basically forms of advanced chemotherapy. Now, colon cancer is one cancer wherein laparoscopic or robotic surgery is very much possible. Advantage of laparoscopic or robotic surgery is that it improves the recovery, reduces the pain, thus faster return to life, thus faster return to work. Colorectal cancer, again, the good news here is that almost half of colorectal cancers can actually be prevented. What are the ways to prevent it? First, it starts with lifestyle and diet. So, having a diet which is high in fiber, that includes fruits, vegetables, whole grains, reduction in the consumption of red meat and processed meats, processed foods as well, staying active, maintaining a healthy weight, avoiding smoking, avoiding excessive alcohol intake. These are all ways to reduce the incidence of colon cancer by 50%.